Hi, my name is Michelle Bruno, and I am doing my week 2 presentation on Huntington's disease distribution. I chose Huntington's disease because we spoke about it in my healthcare ethics class in regards to genetic testing. So I did find it interesting, so I just wanted to learn some more about that. So Huntington's disease, we will talk about what it is, the distribution, and some managerial applications. What is Huntington's disease? It was found by Dr. George Huntington in 1872. It is a genetic disease affecting both men and women. Children of someone who does carry this genetic disease have a 50% chance of inheriting it. If they do carry the gene, they will have Huntington's disease at some time in their life. They then have a 50% chance of passing it on to their children. Unfortunately, it is a disease that has a later onset between the ages of 30 and 50. So often people have already had their children and maybe didn't know that they had the disease. So, they have possibly passed that on as well. It causes a degeneration of the brain cells. And once symptoms appear, normally the lifespan is only another 10 to 25 years after those symptoms do appear. Some of the symptoms are, there's 3 categories. Movement, which are spasms, tics. As it progresses, it can lead to difficulty producing speech because they can't control their muscles. And then also difficulty swallowing, which then ends up causing often pneumonia and also rapid weight loss. There's also uncontrollable movements. The cognitive symptoms are slowed brain process, difficulty learning new things, difficulty multitasking. They have impaired perception, so they may run into things, and then they will then have difficulty communicating it as well, which leads into the psychiatric symptoms. The difficulty communicating kind of goes hand in hand with that. It can cause depression. People are frustrated because they aren't able to express themselves. Personality changes, irritability. They can have obsessions, also delirium and manias. Unfortunately, there is no treatment for the disease. There is only treatments for the symptoms at this time. The distribution, I had found some information for the world maps, European, South Africa, and the United States. So this is the world map, just a general overview. Venezuela actually has the highest amount. United States, Europe, and Australia also have a higher prevalence than other countries. The highest frequency is Europe and countries of European descent. The lowest frequencies are Japan, Africa, China, and Finland. This is England. Finland, you see, has a lower percentage than the rest of the European nations. Here it is. Europe has 400 to 100 cases per million, and Finland has about only 6 cases per million. That is because they are a genetically distinct population from the rest of Europe, so they have a more diverse genetic background. This is South Africa. On the left-hand side is the white and mixed population, and the right-hand side with the lower prevalence is the black population in South Africa. The white and mixed population come from Dutch or British ancestry. and there are between 1 and 10 per million cases. The black population has only zero point 0.6 cases per million. The United States has over 30,000 cases of Huntington's disease. That comes out to 100 cases per million. The European American descent, they have a uniform distribution. The African Americans have about 15 cases per million. And the Native Americans have no documented cases in the United States at this time. Some managerial applications. I think this information could be used. We would need to do an institutional level needs assessment to determine needs for services in our community. And then planning to increase resources to support the needs of the Huntington's disease population and their families, including genetic testing, education, possibly a neurology program, and definitely support for the families as these people are dependent on them in the later stages of life. Thank you.